Cancer is when abnormal cells begin to grow out of control. The cancer can keep on growing and making new cells. This causes problems in the part of the body where the cancer started. Cancer cells can spread to other parts of the body. For instance, cancer cells in the lungs can travel to the bones and grow there. Some cancers grow and spread fast, others grow more slowly. Most cancers form a lump called a tumor or a growth, but not all lumps are cancerous. Doctors take out a piece of the lump and look to see if it's cancerous. Lumps that are not cancerous are called benign. Lumps that are cancerous are called malignant. Sometimes it's very hard to find out exactly why a person developed cancer, but research has shown that certain risk factors may increase a person's chance of developing cancer. Some risk factors include age, alcohol, cancer-causing substances, chronic inflammation, diet, hormones, immunosuppression, infectious agents, radiation, sunlight, and tobacco.
In order to manage cancer pain, it is important to understand how this pain occurs. Pain can be caused by either the treatment or by the tumor itself. The tumor can cause pressure or cell invasion, which can cause direct tissue, bone, and nerve pain. Treatments such as surgery, radiation, chemotherapy, and inactivity can also cause cancer pain. There are two types of pain: acute and chronic. Acute occurs suddenly and is short-term. This can be as a result of surgery. Chronic pain results from nerve changes and lasts longer than 3 months. For example, tumor growth and the effects of the surrounding tissue, like destruction or pressure, can cause chronic cancer pain. Some medications that can be used for cancer include non-opioid and NSAIDs for mild to moderate pain. Those include like acetaminophen or aspirin or ibuprofen. Also, opioids can be used for moderate to severe pain or breakthrough pain, such as morphine or fentanyl. Also, antidepressants are used, which decrease the neuropathic pain and increase serotonin levels to improve feeling of well-being. And those are basically drugs that end in INE. Also, anticonvulsives can be used for neuropathic pain. Those include like gabapentin or valproic acid. Also, corticosteroids are used to reduce the pain by reducing the swelling. And those are medications like prednisolone. Also, sympatholytic agents help with neuropathic pain. Those are drugs like clonidine. And the last drug that can be used are skeletal muscle relaxants. They are used as an adjunct drugs for muscle spasms that accompany cancer pain. And those are drugs like baclofen.
There are 3 major categories for the most common cancer treatment options. There's surgery, chemotherapy, and radiotherapy. Surgery, or the surgical removal of tumors, is one of the oldest treatment options for cancer, going back several hundred years ago. If performed at an early stage before metastasis or before the cancer cells have spread to another tissue or organ, this method can be very successful. However, some surgery is much easier and less dangerous for some cancers, like cancer of the skin, than others, like cancer of the brain, which can be, depending on the location, can be very difficult to reach and remove and can also be very dangerous. Surgery is not an option for cancers involving the blood and lymph, since these cancers are widely distributed throughout the person's body. The second most common type of cancer treatment for tumors is radiation therapy or radiotherapy. The radiation of choice is X-rays, which can penetrate the body to reach a tumor in very high dosages using modern equipment. X-rays can be focused on a specific small area or be administered over the whole body in the case of metastasized cancer. Therapeutic radiation damages genes to such an extent that they become physically fragmented and non-functional, which ends the life of the target cell. Radiotherapy has major drawbacks. One of the most serious problem is that the normal cells in the path of the radiation can also be killed. For example, for whole body cancer treatments, bone marrows are also destroyed. It can be overcome though by bone marrow transplant. Also, very ironically, the radiation that are designed to kill cancer cells can also cause malignant mutations in normal cells. There are recent innovations in radiotherapy that um, localizes radiation, such as the gamma knife. It delivers radiation precisely in the center of the tumor that prevents the damage to the surrounding cells. If a patient has metastasized tumor cells, radiation and surgery are not the treatment of choice because neither of these two act systemically. However, there's chemotherapy. Chemotherapy is the most common systemic treatment because it can reach everywhere in the body. Patients are given chemicals or drugs that prevent cells from duplicating or slow the process. These drugs reach all parts of the body and is more effective than surgery, especially in later stage cancers. Similar with radiotherapy, the most common problem with chemotherapy is that the same drugs that stops the growth of cancer cells also affect the normal cells, such as the white blood cells, which is necessary to fight infectious disease. So chemotherapy depresses the immune system, so patients with chemotherapy are more vulnerable to bacterial and viral diseases. Also, red blood cells do not carry oxygen optimally during chemotherapy, which makes the patient breathless and appears sickly. And skin often becomes pale and unhealthy looking. The digestive tract also the digestive tract cells also stop dividing, causing weight loss and digestive problems. And the less serious irritant for such patient is hair loss, since hair follicles are also prevented from growing.
Nursing care of clients receiving chemo generally includes education. For example, educating the patient on preventing infection by frequently washing hands, providing them with a private room, allowing healthy visitors to visit, and asking ill visitors to wear masks. Also restricting foods that can be contaminated with bacteria, such as fresh or raw fruits or veggies, undercooked meat, fish and eggs, pepper and paprika. Also, it is very important to monitor the white blood cell count, which shows signs of infection. And also preventing transmission of bacteria and viruses, such as not allowing live plants or flowers, also using HEPA filtration. And lastly, and most importantly, it is very important to avoid crowds when undergoing chemotherapy. Nursing care also includes preventing injury, such as monitoring platelets and teaching the patient to avoid trauma, such as using electric shavers, soft bristled toothbrushes, and avoiding contact sports. Also, it's important to monitor labs for anemia and thrombocytopenia. And signs to look out for are fatigue, pallor, dizziness, and shortness of breath. And per MD orders, it's important to administer erythropoietic medications that help stimulate red blood cell productions. Also, nurses need to monitor and manage the side effects of chemo treatment, such as nausea, vomiting, inflammation, and ulceration of the mucous membranes, hair loss, and anorexia. Nursing care also includes taking temperature daily and educating the patient on reporting fevers, such as greater than 37.8 Celsius and 100 Fahrenheit, and reporting elevated temperature to the provider. The way that cancer pain is managed is through palliative pain management, which provides comfort and reduces pain rather than actually curing the cancer. The goal of this palliative pain management is to reduce pain to improve quality of life while maintaining dignity and mental clarity. Also, procedures such as surgery, chemotherapy, and radiation therapy can reduce pain by removing the tumor or reducing its size, which can alter the pressure on the tissues and organs that are surrounding it.
And I'm never going to give up. I'm not going down with the fight.
And so she fought. She fought like her life depended on it, because it did. She wasn't even old enough to have a mammogram, but cancer doesn't discriminate. What this young woman went through in her battle against breast cancer. You know, your diet is just one of the things that changes when you get that cancer diagnosis. A Baltimore County woman watched her world be turned upside down in February when she learned that she had breast cancer. She was so young, she never saw it coming.
On the count of 3, 1, 2, 3, deep breath in.
Jamie Williams has been through a lot this year. At the young age of 36, she was diagnosed with stage 2B breast cancer.
I've come to accept it and embrace it and learn to live with it.
She wasn't even old enough to have a mammogram when she noticed something wasn't quite right with her body. She lobbied her doctors for the screening. In February, a series of tests at the cancer center confirmed there was something. And in one day, after she had a mammogram and then an ultrasound, by the time she left, she learned she likely had breast cancer.
Your whole world kind of comes crashing down. You feel like your life is going to end because you don't know what's going on. It's really scary.
Her husband, John, of 18 years, was quickly by her side to help her digest the news. But she couldn't bring herself to tell her 2 daughters.
My husband did, because I didn't have the words. I was really pretty upset, and I was worried about them.
After it sunk in, her family rallied. She had a double mastectomy and 17 lymph nodes removed. But it wasn't always easy.
Everybody's going to have their ups and downs, and there's a time to cry, and that's hard to realize sometimes, but there's a time to cry.
It's been an unforgettable year. From John and her dad tag teaming shaving her head to her girls celebrating her last chemo treatment.
I made it through it. Some people don't, and I am one of the lucky ones. And I feel very humbled that I'm able to be one.
All she has left are infusion treatments in hopes of preventing a recurrence because she's so young.
We're temporarily putting her through menopause so that we can provide her with a longer, with a better chance of preventing breast cancer.
With a smile that lights up a room, Jamie already has her sights set on the Susan G. Komen Race for the Cure later this month. She didn't ask to join this cancer club, but she says she's in it to win it.
Never give up. And I'm never going to give up. I'm not going down with the fight. I'm really excited to walk in the Hunt Valley October 23rd walk. It's going to mean even more because I'm going to be able to say I'm a survivor.
The American Cancer Society provides support to cancer patients and their families at no direct costs. This includes transportation to medical appointments, reimbursements, lodging, support groups, and wigs. They provide information on all types of cancer and prevention education. Not only does Dignity Health have advanced cancer treatment services, but they also offer cancer support classes and programs like supervised exercise programs, meditation in motion, yoga, and they do special events for any holidays where you can gather with your friends and family. They have specific support groups like breast cancer and prostate cancer support groups, but they also have generalized support groups for any type. Yo, listen up and open your ears. I'm gonna tell you how to elongate your years. This is how to try and lower your risk. Pay attention, it's stuff you don't want to miss. First of all, it's all in how you eat. Consume healthy veggies and fruits and skip on red meats. Don't forget about your immunizations. Get the HPV to avoid any mutations. Don't grab the lighter and start your cig. You might end up doing chemo and wearing a wig. Avoid work hazards and use PPE. Try to avoid radiation, chemicals, and any dangers you see. Check that skin and tell your doctor of pneumos. Catching it early might prevent you from ending in the hole. Using sunscreen and protecting your skin from the rays is going to help you live a cancer-free way. Yeah. Cancer-free, everyone. Now let's go into some important screenings. If you're a female, this test has an important meaning. You can do it from home. It's a self-breast exam. If you feel a lump, you might need a mammogram. Don't forget to get your pap smears done. Check those cells and make sure your cervix won. Now, all you men, I got you covered. You can do this at home. If you wondered, perform this exam after a warm shower. Self-testicular cancer screening will give you the power. Don't you worry, your rectum won't be left behind. A rectal exam and colonoscopy to see what they might find. You might wonder what they use to diagnose. CT, MRI, ultrasound, X-ray, but biopsy for most. Treatments are radiation, chemo, and surgery. Side effects suck but better than being buried. Surgery typically works best if it's localized, but chemo is the treatment if it has mobilized. Go along and pass on the education so we can all hopefully stop all the mutations.